Well, although we talk, of course, year-round about breast cancer and how your chances of beating the disease start with early detection and those annual mammograms, October and Breast Cancer Awareness Month are, of course, just around the corner, and it's estimated that about 30% of newly diagnosed cancers this year in women will be breast cancer. So today, Dr. Mindy Beam, a board-certified general surgeon at Centerpoint Lee Summit and Research Medical Centers, joins us now to explain kind of a new way to look at the age guidelines on this. We always hear age 40 with our mammograms, but you say at least start thinking about it much earlier.
Yeah, so earlier this year, May of this year, the American Society of Breast Surgeons released new recommendations regarding screening for breast cancer. And so one of the main points of this is that we should be looking at women between the age of 25 and 30 and doing a formal risk assessment to determine whether or not these women actually should be screened earlier for breast cancer rather than the average.
So you're not saying do mammograms at 25, but
no.
just do a risk assessment. What does that mean?
So at the age of 25, the recommendation is that women should have a risk assessment, which means that you talk with a health professional and they're really looking for any red flags in your history that might say that you're at a really extreme risk of developing a breast cancer or risk of developing breast cancer early. And then by the age of 30, the recommendation is that women undergo a formal risk calculation where there are lots of models that we can use to calculate a woman's lifetime risk of developing a breast cancer. And so when we look at that, we're going to be stratifying those women then into an average risk group or a high risk group. And those who are high risk may actually need recommendations to start imaging sooner, maybe at age 35 or even earlier than that.
Wow.
And instead of just a mammogram, they may need an MRI. But for those women who, when their risk is calculated, fall into that average risk group, those are the women who, as we've recommended for years, just continue. The recommendation is to start their mammograms at 40, continue it every year until as long as they're in good health.
So I kind of like this, though. It's kind of no longer a one-size-fits-all, blanket statement for screenings.
Right. So, we wish it were. It would certainly be easier.
Well, it would.
A lot of women feel like it would be nicer if it were like that. But we recognize that mammogram is a great tool, but for some women, it's just not enough and it's not early enough. And so we really need to look at those individual risk factors.
Okay, so can we talk about some of these risk factors that really could maybe alarm you if you hear about them with a young woman?
Yeah, so I divided them kind of into three different groups. The first are those that are really would put someone at make us think if they might have an extreme high risk of developing a breast cancer. Those would be things like a history of chest radiation or mantle radiation when they were younger, usually between the age of 10 and 20. Anybody who has a known family history of any of genetic mutation that might predispose them to breast cancer, like the BRCA gene. And then also any patient or any person who has a family member, a mom, a sister, a daughter with breast cancer or ovarian cancer. Then we have another group of risk factors. Those are the kind of more moderate risk factors. Those are the risk factors that will put put many people into a high risk category. Those are a more extensive family history of breast, ovarian, pancreatic, prostate, other cancers. People who are of Ashkenazi Jewish heritage, people who've had early first periods, late menopause, and who had babies later in life. Oh. And then the third category are those risk factors that all of us kind of go through. They usually won't put you into a high risk category, but things like age, we know that increasing age will increase your breast cancer risk. Alcohol intake, we know that any amount of alcohol intake can be associated with increased breast cancer. Obesity, and specifically postmenopausal weight gain, those are also factors that can increase your breast cancer risk. And breast density, which we're recognizing more and more as a really important factor in breast cancer.
Dr. Bain, thank you so much for coming by. Bottom line is, start talking about it. Mm-hmm. The earlier, the better.
Definitely.
Yeah, no longer wait until it's not an after 40 thing anymore. Right. So we thank you for stopping by. For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.